What does it take to become a doctor? These are the real-life stories of McMaster University's med students. This week on Med Students.
That's what they need.
Vikram works with a worried cancer survivor. Kathleen toughs it out in the ER. And Sam deals with inner stress with an inner tube.
It's going to get ugly, but it'll be fun whatever happens.
Clerkship, when training is hands-on and shifts are 24 hours long, is the most stressful time in a med student's life. It's crucial to find a way to blow off some steam.
My name is Sam Stone. I'm a second-year med student and clerk at Mac. And I'm also captain of the Intubators.
The Intubators is a water polo team made up mostly of med students.
There's water polo, which I understand is a very serious sport. There's inner tube water polo, which is slightly less serious. We're inner tube water polo intramural co-ed Division B. We've got a core group of a dozen people that show up. You know, we cheer for their goals and cheer for our goals and just cheer and splash at anything that moves. So it's a good chance to hang out with the people that I see a lot in serious situations, and some people I don't get to see much anymore because we're on different rotations or at different hospitals.
Even when the Intubators lose, Sam gets what he needs from the game.
Well, it does help me de-stress from clerkship, but we've actually had a pretty good season. We're 500, so either we do really well and it boosts the team, or it keeps us humble, like today.
Sam's first clerkship rotation is in general surgery at McMaster University Hospital.
The nerves I think I mostly put on myself. I'm only in second year, so the whole environment is still new. I'd love to be a part of making the incisions, which rarely happens, but sometimes you get to. I'd love to get a chance to practice suturing again.
Sam's patient underwent a previous hernia repair, but is experiencing painful symptoms which suggest a relapse.
Especially into the mesh, which is amazing.
General surgeon Dr. Susan Reed wants Sam to be able to identify the basic anatomy involved in a hernia operation.
Okay, put your finger in there now, Sam.
All right.
What do you think?
That feels like a hole.
Feels like a hole. It's not the normal anatomy that we usually see, so it's a little trickier. So we're just trying to find his spermatic cord, because we do want to try and not damage that.
Being able to identify anatomy, even when it's not absolutely normal, is essential. Damaging the spermatic cord could leave this patient sterile. Sam's classmate, Kathleen Howell, is working her first shift in emergency medicine at Hamilton General Hospital.
I'm always a bit nervous when I'm starting anything new.
She's in here.
There's a lot of unfamiliar things going on at once.
Kathleen will be supervised by ER physician Dr. Christopher Fernandez. The speed of the ER could be hard on Kathleen, whose first career was as a counselor.
See the history?
You just don't have the chance to establish a therapeutic relationship with each and every patient coming in. You've got 15 minutes, and that's a luxury.
Kathleen's first patient has an eye problem.
Join me. Please have a seat right here, and we'll take a look at your eye. I understand you've been having a hard time. You're not here for your foot.
Not on this way.
She has 15 minutes to take a history and report back with a possible diagnosis and treatment.
Myself, what's brought you here?
This morning, it was swollen, puffy.
Right.
So I put some hot water on it. It wasn't pink eye, because pink eye just doesn't swell.
To the sticky substance that I can see. I don't think I've actually done a full eye exam on a patient before, so I feel a little bit like I'm making up as I go along, but I don't even remember what I'm supposed to be doing as I go along. So, it's challenging.
Sam's anatomy exam continues in the OR. The team has managed to locate the spermatic cord.
So we found his spermatic cord, that's good. I have no idea.
But now they have a bigger problem.
We just haven't been able to decide whether he's got a hernia.
A hernia is caused when the intestine pushes through a weak area in the abdominal wall. The anesthetist will fill the patient's belly with air to help the team locate it.
Do you know why we're doing that?
Well, you want to increase abdominal pressure and see.
We want
if
to
you
increase the abdominal pressure just to see
Or
if we're
something.
missing a hernia, to try and make something pop out. Nothing. We're gonna close it.
can- No hernia found?
We cannot find a hernia.
Sometimes the procedure has to change. Sometimes the procedure has to stop. And just close it up.
Pull this right through.
See hand tights.
You gonna hand tie it?
No,
Have you been working on this?
The surgical team will refer the patient back to his primary physician to look for another cause for his pain.
That's good.
Well, let me talk to Dr. Fernandez. Why don't you sit tight and we'll be back.
All right, thank
Okay?
you. Yep.
Kathleen's ready to take a stab at doing a formal patient report.
This gentleman, on exam, he's already been given some atropine.
Give me the history first.
Give you the history. The eyelid is actually turned inside out and he can't open his eye. There's,
Okay, you've got me a bit confused.
okay,
So he's had the knee strain for a few weeks, he's been off.
yep,
And when did the eye problem start?
this morning.
Okay.
There's a palpable, sort of pea-sized mass in this region. on
Okay,
down
now
the
you're
eye.
going from history to physical and back to history. So
Okay.
you need to stay consistent. Give me history.
Right,
Tell me all about it.
And
Give
then-
me the physical
and wait.
and tell me all about it.
to give you the juicy
But you can't go
bits.
back and forth.
Right,
There's 9 things you should tell me when you're telling me about an eye exam.
all right.
So what are they?
The visual acuity, pupils, reactivity.
2 out of 9.
So approach to red eyes, my homework.
Good.
Thank you. All right, here we go.
Kathleen is sent back to get the missing information.
There's some things that I forgot. So I'd like to do some more. That was awkward overall, but I think that my expectations of myself are too high. And that adds to not feeling as comfortable as I'd like to. I know, it's hard. It's just hard to take when I kind of don't know what I'm doing and I'm learning on the spot in front of the patient. So we'll let you get out of here, but let me give you this prescription for the antibiotic. Good to meet you tonight.
You too.
Take care of yourself.
I love that line though.
Sam accompanies his patient to the recovery room before moving on to the next case.
The next surgery is the removal of a lump in a patient's right breast. She has a history of cancer and she's had operations to both breasts already. Now, I understand this patient has, because of the other surgeries and the other experiences, has implants. So it's going to be a delicate balance of taking the lump out, making sure one can get as much of it as one possibly can, but leaving the implant intact.
If it's cancer, then we want to be sure that we've gotten a good margin around this. It has huge implications for her future. So it looks like a tiny operation, but it's crucially important for this lady.
How likely are we going to see cancer?
You just can't tell. And because of her history, since this is not the kind of person that we would just follow. She's had cancer once already, so.
25-year-old Vikram Venkateshwaran is one of the youngest members of the class of 2005. He loves sports and he loves surgery.
My goal for today would be to start doing things a little bit without being told to do this or do that, not causing any complications or not slowing things down.
Vikram is assigned to the general surgery ambulatory clinic at St. Thomas Elgin General Hospital.
I think it's pretty cool, getting your hands in there and fixing the person. You're improving their quality of life or even saving their lives. Hello.
His first patient, Paul, is a cancer survivor. Now he's discovered a new lump.
I don't know how lymphoma could reoccur when I've had chemo for it. But something else could come, couldn't it?
We can't tell what it is. You have to send it to the pathologist, and they're going to have to do some tests for it.
Who does the carving?
I've done it before, so you don't have to worry too much.
Learning to help patients relax in frightening situations can be a challenge for young med students.
That's okay. You gonna watch the game tonight?
No, I put up with hockey, that's about it. I liked hockey until it went into baseball season.
You're a big baseball fan. So who's your favorite player? Do you have
Who's
one?
my favorite player? Yeah, Andrew Jones, center field, Atlanta Braves.
He's pretty good. Most of the patients, when I'm seeing them in the clinic, they enjoy seeing a young face. And I'm back in a second, okay? He seems like a big baseball fan, and I enjoy talking to patients about that stuff because I'm very interested in sports too. So he had a lot to say about that, so it was good. It's good rapport building with the patients.
Back in the OR, Sam helps Dr. Reed prepare to remove the lump from their patient's breast.
When the needle is popped in, is the lesion right at the tip of the needle?
Depends. Like, you just have to watch and see. So the tricky thing too is that she has an implant in place, so we really don't want to disrupt that.
The patient's reconstructive implant is secured with wires, making it more difficult to remove the lump cleanly.
What happens with the wires is you end up taking a little bit more, and in hers, like, you can still see the wire in place in her breast, right on top of the capsule from her implant. So that specimen goes back to X-ray and then it goes over to pathology. Amazing.
Vikram's work in St. Thomas is supervised by McMaster grad Dr. Hugh McLaughlin.
I examined him. He has a lesion on his back now that's developed over the last month.
Okay. All right. Let's go and get it organized.
Okay.
How are you doing?
Wait to see the size of the knife.
Oh, well, we'll get you out. It's a big incision. You have to take that out because I want to take the whole thing so that they can have a look at it and then take an idea of what that is.
Okay, you're gonna feel a little needle poke, okay?
Vikram freezes the area around the lump before he cuts into Paul's back.
I found it.
Having a med student remove a suspicious lump could make even the most easygoing patient a little uneasy.
Are student doctors better than the old timers or not?
Sure they are.
I just like to get the best. I was a teacher, and we used to have to put up with those student teachers too, so I know what you're going through, Dr. McLaughlin.
That's my choice.
Putting up with me.
Oh, I always enjoyed it.
Vikram does a great job getting the lump out and getting the incision sewn up.
We're going to put on a little plastic dressing you can have a shower with. Okay? All right?
Do you feel anything?
Not really, no.
Freezing worked.
Freezing worked. I'll probably feel later on, time I get home.
It's just like, I don't know.
Becoming a doctor means learning to balance patient care and a demanding schedule, and nowhere is this more difficult than in the emergency room.
It always helps when you put it in the right way, I find. The pace is challenging in the sense that I'd probably sit down more and think about what I'm doing, and I don't get enough of an opportunity to do that. But I'm not expected to necessarily save lives and stamp out disease on my first ER shift.
Kathleen's next patient may need life-saving measures. He's come to the emergency room with symptoms of a heart attack.
It started really pain. I got a lot of pain and it just stabbing there.
Did you say the word stabbing, or was it sharp?
Not like squeezing, just stabbing.
Have any numbness or tingling in your arms?
Sorry, arm, left.
Sore left arm?
And here, quadrate, and the arm.
Okay, this upper quadrant, is that what you said?
Yeah.
I'm sorry?
Yeah.
And how far, all the way down your arm?
No, but no use to complain.
Yeah. Okay, that's all right. You're who you are, Frank. That's okay. So we're gonna keep you for a while.
It looks like it.
Yeah. Well, I'm glad that you came in this morning. Well, it's important to take care of this.
Yeah.
Okay?
Frank will undergo further testing to determine if he has had a heart attack. While Kathleen waits for test results on her heart patient, she's given another case to juggle. Dawn has also come to the ER with chest pains.
Do you ever have chest pain at work because of the activity?
Yeah.
12 o'clock last night, shoveling, more central pain.
Yeah.
How long did the pain last for?
4 in the morning, maybe, 5 in the morning.
Can you think of anything else that's been different about your situation?
Weak in the legs.
Weak in the legs.
Yes.
I think I'm happy with the rapport that I have with the patient, and I'll take the time to have that. That's important to me. And a situation like this is a lot of anxiety around the possibilities, and so I'm happy with that part of the work that I'm doing. In the meanwhile, the most important part is trying to get the facts that we need. So shoveling, that's a big load.
Yeah,
that's a big activity, right?
Yeah.
We already have some blood work back on him. We know that he did not have a heart attack in that 5-hour episode last night.
Right.
But if it is exertional, you can tell them don't do that.
Yeah.
The ER staff will refer Dawn's care to a cardiologist. Dawn will have to take it easy until then.
I think really you're not going to be doing some work for a little while, or you're going to be doing something that's not going to provoke your angina.
General surgeons have a reputation for testing the limits of their clerks' physical abilities.
One step at a time.
Laparoscopic surgery, which requires illogical hand-eye coordination to work miniature instruments and cameras, is something many students dread their first time out. Today, it's Sam's turn.
It's underneath the lure. There. Oh, there it is. Tricky.
Sam is becoming an expert cameraman. Wow, that's picture perfect.
There's a little bit of pressure in the OR, especially with the teaching, and the eyes on you. But without exception, I mean, everybody's been really nice and really supportive, and the nurses have been friendly, the docs have been nice, and as long as I keep learning more than I'm forgetting, then this is the way it's supposed to be going.
Kathleen has news for Frank, her first chest pain patient.
We're back again.
That'll be double and a half.
How are you feeling since we talked this morning?
No cushion on that.
Frank, I was talking with the doctor just now, and he wanted me to let you know that we have some more of the test results back.
Yeah.
Okay. And there's an enzyme that we measure in your blood called troponin. And that has come back as positive. So it may mean that you've had a mild heart attack.
Yes.
Okay.
Good news could be better.
It could be better.
Yeah.
The good news is that you're here and you're going to have some care. We're going to take care of you here.
Well, I hope so.
Yeah.
Kathleen's made it through her first emergency medicine shift.
We had no suture.
Dr. Lolchik gives her feedback on how she's doing.
You take a good history. I think that's clearly what you do well. Your problem at this stage is that you just don't have enough experience with the knowledge that you're putting together. That's about it.
Yeah.
And you did a good job.
Okay. It's been a zoo, so to speak.
Yeah.
It's been.
Showed you how intelligent ER physicians are, how nimble we are in our feet.
Well, you've kept your cool, right? So just being around that and the energy and your thinking and showing me, like, at every point, taking the time to do that has been really impressive. So I want to thank you for that.
Good. All right.
All right. Emergency medicine is not for Kathleen, no. Because I've got a turtle pace. I like to take a long time with people, and there's lots of parts of medicine that are probably not meant for me because I want to take more time to connect with people than is often necessary. I really value and appreciate people whose skill set allows them to think that quickly on their feet. And as someone who might be treated in emergency medicine, I want someone to make good decisions quickly. And I just don't know that I have those gifts.
Clerkship can be humbling, but Kathleen has her own way of dealing with the stress.
I really want to have these in my clerk jacket and like pull them out, and sometimes people are really too serious and super competitive, and occasionally you'll have to work next to another medical student who's really trying to impress the faculty member. And so I just want to be able to pull these out and say, let's see who gets their residency first. Ooh, there you go, you're the winner.
Sam continues to work the camera in his first laparoscopic surgery.
If you've never seen an open gallbladder operation, it's hard to appreciate what a difference this makes for the patient. We have not lost a drop of blood. Yeah.
The team gets ready to pull their patient's gallbladder through a tiny incision in his abdomen.
Suck the bile out, and then the gallbladder will come out. There we are. That's it.
There are some aspects of surgery I really like, the hands-on. There's a real sense of sort of immediate intervention and immediate gratification. Should I become a surgeon, I like to think I'll be comfortable.
I'm looking forward to becoming a doctor, but I'm enjoying the process along the way, and even when I graduate, and then residency starts, and then on from there. I don't think the game ever ends.